I'm Congressman Ed Case. I represent the 1st Congressional District in Hawaii, which is urban Honolulu, Makapu'u to Mililani, and all the way out to Ko'olina. Kai Kahele, my partner, represents the rest of the state, but for all intents and purposes, we don't care about district lines. We're all trying to help the entire state, and so we don't pay attention to where the boundaries of that are. The Kupuna are all of our constituents. I thank you so much for joining me this morning for really what I hope will be a discussion. We are focused on the needs of our 300,000 or so Kupuna living throughout Hawaii, the Kupuna that have very special concerns and needs in many cases, and all of that aggravated tremendously by COVID-19. And so for me, this is about making sure that what I'm doing in Congress on behalf of our Kupuna and you aligns with what you are doing. It's about trying to share information, because I believe strongly that as we share information with each other on what we're each and all up to, that we can all, kind of get a sense of best practices. Also for me, this is an opportunity to provide you with information on how to use my congressional office in your work, because of course our federal government has major concerns in the area of our Kupuna, from programs to regulations to funding to COVID-19 specific relief, and to initiatives that will improve our Kupuna's lives throughout our country and state. And so as I share with you what is available in my office, I hope to help you to do your job, and I hope to get from you what you're doing so that I can do my job better. So just a couple of the logistics, and then we can punch into this. I already covered that we are recording this. We plan on going about an hour and a half to 10:30. I plan on doing a little of the talking and having you share what you're doing and comment on it. We have a lot of folks besides our presenters that are on the call that are here to share as well and to learn. We're going to try to provide some opportunities for Q&A. But also for everybody, this is about highlighting some of the areas so that you can all follow up independent of this particular seminar. I want to say up front, case.house.gov. Case.house.gov is the way into my office. That's my website. It will have information on what I'm up to, of some of the initiatives, and importantly, how to contact me. However, on the call here today are the folks in my office that are my principal assistants and fully available to you in this area. And so I do want to introduce them. You're welcome to contact them directly. Nick Luna here is my legislative assistant for Health and Human Services concerns, to include Kupuna. He's been on the Hill for 10 plus years now, in my office for a couple of years. And so he's going to be easily your best resource to just cut to the chase on a lot of this stuff. Jackie Conant there is my Deputy Chief of Staff. Nick is in Washington, D.C., by the way, even though he has a nice aloha shirt on today. Jackie Conant is my Deputy Chief of Staff and my District Director. So as you can see behind her, she's in downtown Honolulu, and she is on the ground for me in my district and throughout the state. And she is the easiest access kind of on a physical logistical basis into my office, and can cut through things if it's not working for you, especially given that I spend 6+ months of my year in Washington, D.C. So we also have on the phone Emily Peterson, who is a University of Hawaii intern in my office and has helped us put together this particular presentation and webinar. So we thank her for that. I am going to introduce my fellow panelists today up front, and then as we go through, we will get to you. So first we have Representative, and by the way, thank you so much for joining us. This is really an all-star panel, and I really appreciate your partnership. First up, we have Representative Troy Hashimoto, who proudly represents Maui in our state legislature. Troy has quite a length of service on the City Council with Council Chair Mike White. and focuses especially on Kupuna as a co-chair of the Kupuna caucus. Thank you, Rep. Hashimoto. Keali'i Lopez is the state director of our AARP, our Association of Retired People that many of us are members of. And Keali'i not only has a very strong background here in Hawaii, but the AARP team is really pretty awesome on the national level as well, in terms of especially working with Congress, tremendous resource for us all. Dr. Robert Hirokawa is the Chief Executive Officer of the Hawaii Primary Care Association. He's been in that position for over a decade now. Formerly was an epidemiologist with the State Department of Health and the Healthy Hawaii Initiative, and so brings a tremendous reservoir of knowledge and experience to the actual front lines delivery of healthcare, especially to our Kupuna. Derek Ariyoshi is our county executive for the Elderly Affairs Division with the City and County of Honolulu, which really does a great job in this area. And so I really appreciate Derek's contributions here today, and we hope to hear from him on how the City and County of Honolulu is working for our Kupuna. They have gotten awards, national awards in recognition for the administration of our COVID-19 emergency assistance funds, and are really just doing really good work. And then finally, we have Paige Heckathorn Choi, who is the Senior Director of Government Affairs for the Healthcare Association of Hawaii, which represents many of our healthcare facilities and efforts throughout the state. They have been very much on the front lines of COVID-19, representing the largest hospitals to our community centers and beyond. And so a really good sense of kind of how we are trying to deliver healthcare for our Kupunas. Paige also comes out of our legislative family. She previously worked as health advisor to Senator Schatz. So I always appreciate the folks that are back here in Hawaii that have experience in our congressional delegation offices and on the Hill, because they're tremendous resources for how to navigate between the federal government and our communities back home. So that's who's going to help me do this. Let me just give you a couple of comments up front about kind of where I fit into the picture of Kupuna care and Kupuna assistance in Congress. And of course, my job is the federal government. My job is, what is our federal government doing for our Kupuna in this case? And that comes into play in a couple of different areas. The first is national policy, national programs, national efforts that have applicability across our entire country. One area, for example, would be drug prices that I'm very much involved in, and I think we all are involved in. These are functions of national laws and national restrictions, which frankly I think should not be there. But these are decisions we make at the national level that are going to have an impact on Hawaii in one way, shape, or form as part of our country. And so I deal a lot with these issues because, of course, Kupuna care specifically, and health and housing and the other areas that are particularly important to our Kupuna are all national issues in one way, shape, or form. The second area that I work with our Kupuna on are how are our national programs actually translating here in Hawaii? What is our federal government doing for us in Hawaii? So that's a very specific Hawaii focused bucket, if I can put it that way. So it's not so much about, leading on national policy, but it is very much about, okay, fine, we have these national policies. Now, do they work in Hawaii, and are we getting the resources in Hawaii? And as we all know, we have some very unique situations in Hawaii that call for very unique and tailored actions by our federal government. I would cite to you, for example, the fact that we have islands, which changes how some of our policies have to apply, especially in Kupuna care. I would also cite to you our incredible ethnic diversity, which provides incredible differences sometimes in terms of how those programs actually apply in Hawaii. And then the final bucket is helping with individual concerns, because everybody encounters our federal government in your individual capacity at one time or another in your life. Some all the time and some hardly ever. But as my old boss, Spark Matsunaga, US Rep and Senator said, people pay their taxes all their lives and they deserve their federal government to listen to them and act for them. And we take that seriously. So we help a lot of folks with whatever their individual concerns are, especially on the federal side. That tends to come in with Social Security benefits or veterans benefits or immigration would be some of the areas that we help quite a bit. But hey, my office is open for any question. And so if it's not in Mike Quiliana, we can at least get you to the right one. So please use that offer as a resource for the folks that you also serve. Just send them to our office. We'll try to help. Quickly, I'm going to just kind of broad brush this real fast. What are some of the areas that I'm focused on right now? Well, in the area of national programs, national laws, national policies, there are a whole range of areas that I have tried to focus on, and I'm happy to send a summary around so you can get some sense of this. I am, for example, co-sponsors of bills, proposed laws or proposed changes to the laws in several areas relating to our Kupuna. I'm just going to kind of, cite a couple of them. Minority Diabetes Initiative Act, which is to focus on the specific needs of our Kupuna with diabetes, which of course manifests itself in a very different way here in Hawaii in many ways. We certainly are trying to improve Medicare across the board, to protect and strengthen Medicare Advantage. We have a particular issue here in Hawaii with Medicare beneficiaries, which is hurting our medical profession as well as our Kupuna. I'm very much on the front lines of the effort to rein in the cost of prescription drugs. And so I am a co-sponsor of the Elijah Cummings Lower Drug Costs Now Act, which is our main initiative, which would require bulk purchasing of drugs in Medicare and therefore reductions in the cost of those drugs. That's been stymied, by the way, especially in the Senate. Telehealth is a major issue that we've all seen in the middle of COVID-19. We have initiatives on accelerating caregiving, which is so important to our Kupuna, as well as enhancing and strengthening our nursing workforce. We're involved in trying to strengthen the SNAP program to reauthorize the Older Americans Act, which is our primary vehicle to help our Kupuna throughout the country. Those are some of the general areas that I'm involved in. I'm also very much involved as a member of the Appropriations Committee, which is our federal funding committee, and everything having to do with federal funding, both nationally as well as specific to Hawaii and specific to our Kupuna. And so in that context, I work very hard to make sure that we have funded our principal programs that arise out of these laws in areas such as senior nutrition, caregiving, certainly affordable housing, being very high up in the list there. And this is actually appropriation season when we when we are getting ready to prepare our fiscal year 2023 appropriations laws, which that fiscal year starts in October of this year. And so we ask you for your comments and your input on what you think we should be funding. You can go to my website at case.house.gov, and there is a page there specific to appropriations. My staff is also more than willing and available to talk these things through with you to try to match up needs with potential federal funding opportunities that I can then work on in my appropriations committee. And then finally, I will note that, of course, COVID-19 has been a critical concern of all of us, especially throughout the state, especially as we all know in spades that our Kupuna have been particularly severely impacted by COVID-19, not only as a matter of public health, but across the board. And so we have been very, very involved in providing for the federal emergency assistance through the CARES Act and the American Rescue Plan and other acts over the last 2 years that have sent an estimated close to $6 trillion now out there to stabilize our country in all aspects to get us through COVID-19, of which somewhere in the range now of $21 billion has come to Hawaii in the form of assistance to our healthcare facilities, direct assistance to our citizens in need through stimulus checks. Certainly, state and county government has gotten large shares that they are still in the process of determining how to spend and spending, and other aspects. And so COVID-19 is very, very much on my mind. So that's a quick broad brush of kind of what I'm up to, where I think I fit into the picture of assisting our Kupuna and working with you all. I think I just would like to reinforce one more time that the best way for us to work together is to stay in touch with each other, because then I can understand your concerns, your goals, your particular initiatives, and I can figure out where I can help you. And similarly, as you think about what you are doing in the area of our Kupuna, think that you have partners in our federal government, and particularly in the Hawaii Congressional Delegation, and think about the federal angles for what you are dealing with, and let us know that, and we can see what we can do to try to move that forward. Okay, probably talked longer than I wanted to or needed to, but that's a quick report from me on efforts in the Kupuna area. And I'd like to now turn this over to Representative Hashimoto. We generally have about 12 minutes assigned to each of our panelists to include presentation, and then an opportunity just for any discussion or questions directly to them. And then we'll try to leave time at the end for some general Q&A. So Rep Hashimoto, over to you. What are you up to?
Well, thank you so much, Congressman Case, for pulling this wonderful group together. Again, Rep Troy Hashimoto, I represent Maui, but I'm a co-convener of the legislature's Kupuna caucus. I co-convened it with Representative Greg Takayama and Senator Sharon Moriwaki. They both wanted to be here, but of course it's a busy time at the legislature, so they sent the young guy to come and talk to you. But nevertheless, very, very passionate about the issues that we are tackling and working on. I think I personally become very, passionate about these issues because I myself had to try and figure out what to do with my aging grandmother who's now 103 years old. And I see Wes Lowe on the call, and he was very instrumental in helping me navigate through a lot of this stuff, but it showed me firsthand. And there's nothing like actually going through the process of caregiving and trying to figure things out to show you how difficult our processes are throughout the state. I think one of the things that we as a caucus are focusing on, and we meet monthly, and I think some of you actually join us once in a while. So thank you for helping us to try and figure out what we can do as a state to address Kupuna issues. But I think one of the big buckets that we're looking at is definitely the aging in place. We know that the silver tsunami is coming, and I think we don't necessarily have the facilities around us to handle all of this silver tsunami that's coming. And so aging in place will be very, very key to all of this. And I think, Congressman Case, I think, part of the big thing is for the lower income Kupuna, and I think it applies to most of our population, but those Section 8 emergency vouchers were critical, I think, during this time of COVID-19. And I think the Kupuna caucus is trying to take that one step further. We're actually trying to work with the Public Housing Authority to take care of our lower income, specifically seniors 62 and above. So we have a bill moving, and we're trying to allocate some funds to it as a pilot program to see if we can give them a subsidy if they're not yet qualifying on Section 8 or any type of housing vouchers, and it's to make sure that whatever their income it will cover 50% of whatever their income is, or their costs are for their housing. And so we're going to see how far we can get. We need to secure that funding. It's also going to be wraparound services for those seniors 62 and above. But we feel that there's a gap, there to try and take care of those individuals. So that's a bill moving in the legislature. I know that the Office on Aging has also been working on making sure that in aging in place, you need those caregivers. So they want flexibility in the Kupuna Caregivers Program. So there's also a bill there to help them to broaden the Kupuna Care Program in general, to add the Kupuna Caregivers Program under that umbrella. We think that's important to give them flexibility to administer those funds and make sure that we can take care of our, Kupuna in the way we see fit. I think COVID-19 has definitely changed the dynamic of how things are moving forward. And I think it shows more than ever that flexibility and creativity is needed depending on those needs. And so I think we're very supportive of making sure that that can happen. I think a lot of it also is taking a look at, you know, aside from aging in place, we know that families sometimes can't take care of their family members, or they can't get, it's just too expensive to, or you need more help rather than just when what staying at home can afford to you. So at some point we know that you're going to have to find a care home or a foster home, but that process is extremely cumbersome. And I think there is a huge shortage within our community. I think there was actually a care home that was trying to get certified in my district over the past few months. And I come to realize that the state process is practically broken, because you can't even apply to get a care home license, because the state Office of Healthcare Assurance has a pre-screening process before they will even allow you to apply. So people are stuck in this pre-screening process to, I guess it's in theory is to help you, once you apply, move faster. But it's, number one, deterring people from applying because it takes so long, and people are stuck in this pre-screening process to even be allowed to apply. So we're trying to work with the Department of Health to reform this. I think they claim that they need a better database system that's online. They need more bodies in there to help them process this paperwork. So we understand that is an issue, because if we want to get more care homes, the first process is the certification process can't be too cumbersome. And so we are working very hard to fix that, because you know, if there's, even if you're interested, I think people are just being turned away because it's just too difficult, and they find these loopholes that allow them to be a foster home, which, you know, at the end of the day, it doesn't help anyone, because we want to make sure that our care homes are safe, that they are providing the care that is necessary, and we want state oversight to make sure that these are safe places. And so we should be wanting to certify these care homes. So we are trying to work diligently with the Department of Health, but we know that's an issue. And I think hopefully once we fix that, that will open the doors to allow more care homes to happen. We also want to make sure that we're supporting the facilities that are already in operation and who want to expand. I think specifically on Maui, as I said, West Low is doing some really big things to expand places like Halemakua. We think that is what needs to happen. And I think those are the type of state and Fed funds we should be investing in to make those bigger projects happen. I think that is what is going to help the silver tsunami, and also it's going to create a holistic care setting. I think that's the thing that, Halemakua was built back in the 50s, 60s, and it's time to modernize, and they've tried as best as they can, but this big new facility will be able to take care of the next generation of those who are aging. So we'll continue to work with entities like them all throughout the state. But two last things that I do think is very important that I mentioned that we are kind of been mulling over here at the state, and maybe the feds can assist, is we're trying to make sure that we can get hearing aid coverage. I think that's loud and clear. That has been something that we've been told over and over again that is extremely important. I think currently Medicaid only covers the tests, and I think there's a lot of seniors who want that coverage for hearing aids. So we've been trying different things at the state level, but I think the partnership with the feds is critically important. And the last thing that we're really trying to push for, that we've also heard loud and clear, is adult dental. But I think, obviously the adult dental is very expensive. And so I think the feds are already willing to put in most of the funds, but I think it's the state side that is a little bit hesitant to put in on our side. But I think it's very important for the overall health of people. I think oral health is critically important. This doesn't necessarily only apply to seniors, but this is everyone right within our community. So I think at some point we're going to have to make that happen and find the funds and just do it. I don't know if it's just a greater federal match to incentivize the state a little more, but I know with these past couple of years, I think it's always been, a resource issue. So no shortage of things that we're trying to work on, where we're trying to move the needle and make some incremental changes, but a few of the big highlights that I think might be useful to you, Congressman, to at least figure out how we can partner on some of these things.
Thank you so much, Representative Hashimoto, for your commitment and for your obvious passion in this area. Dedicated focus over time is how to achieve results in the legislative process. That's my lesson from my time in elective office, and so you've got to stick with these issues over time. And as you say, try to achieve them in whatever way you can. So thanks for doing that. I'm going to just give you a couple of comments back, and hopefully they'll be food for thought for everybody else. First of all, Section 8. I am frustrated with Section 8 and how it actually works on the ground in Hawaii. Part of it is that Section 8 is a little antiquated across the entire country, but it does not function, particularly does not function very well in very high housing areas such as Hawaii, where there's so little incentivization really to go into the affordable housing side of it, and where, frankly, from my perspective, there's still a little bit too much flexibility to accept or deny Section 8. And there's, there are risks, legitimate risks to landlords that exist that we could remove with Section 8. But I would love to work with any of you on improving Section 8 in particular, because it's one of the few areas where our federal government does play in any substantial level in the area of housing. Most of that is, state and county, and there's a whole bunch of stuff you can do at the state and county level to improve affordable housing, from entitlement requirements to, vacation rentals and et cetera, to mention a few hotspots. But the Fed side of it has been frustrating to me to find the best federal efforts for affordable housing. So I'd love to work with you on that. And then your comment on care home certification. The actual certification is at the state and to some extent county level, but oftentimes the certification will be complicated by federal requirements. And so oftentimes I can assist in at least changing the requirements or the application of the requirements in a place like Hawaii, speaking of uniqueness, where it would give the state a little bit more flexibility in these areas. And so sometimes when I talk to my colleagues at the state and county level, they are presuming that the federal restrictions are unchangeable, and that's not always the case. And so think about it as kind of a big picture. Like, if the state is saying that we can't do this because the feds say we can't do this, well, then we can work on whether that's actually a fair Fed requirement. We probably have time for a quick question from somebody else to Rep. Hashimoto, and then I'm going to move this along. Does anybody else have a question for our representative? I think I can't see everybody on the screen, so why don't you just try to come in rather than raise your hand.
They probably see me enough. Kupuna caucus.
Okay, I will then move along to Paige Heckathorn Choi. Paige, thank you so much. Report from the Healthcare Association.
Great, thank you so much, Congressman Case. And just to start, say that I do really appreciate your staff. I know you talked a lot about how they are always available. That is very true, but they're also been very proactive. So just want to thank every one of them for how helpful they've been to us and our members, which does include the nursing facilities. And that's who I really want to focus on today. In a short presentation, I'll try not to take up too much time, but I did want to just highlight a few very specific issues that we're seeing and a few numbers that might be helpful for everyone on this call to see. So just as an overview, I think it's always helpful for us to see what are the number of facilities that we have, what are the number of beds that we have. We have a general sense of the number of staff, and this ranges from positions who are medical directors at our facilities down to dietitians, housekeeping, right? Those folks who really make sure that everything is getting done that needs to get done in our buildings. And I just really want to note here, though, the estimated number of residents that we have in our facilities compared to the beds that we have. And it's about 70%. And I think occupancy is something that we don't talk about a lot when we're talking about nursing facilities, that we've only got about 70% of our beds filled. We hear a lot about bed shortages. We hear a lot about need. The biggest need here for us is staff. So we have the beds, but we don't have the staff, and workforce is really the number one issue that we're hearing about from our members, not just in hospitals, not just in home health or hospice, but really, I think this has hit the nursing facilities most of any industry, these staffing issues. And this graphic, I think, shows how the nursing facilities have been affected the most by these staffing shortages. You'll notice that there's been about a 15% overall decrease in the labor force for our nursing homes. If you look at it compared to ambulatory settings, if you look at it compared to hospitals, home health, most of them haven't seen a full recovery, And I think Omicron changed a lot in terms of staff availability because a lot of people were out if they tested positive or if they were exposed. But you'll notice here that nursing homes, it just plummeted and it never came back up. It never came back up. And I think we'll talk about some of those reasons later on, and especially when I turn it over to Wes and Susie. So again, 15% decrease, there's no recovery in sight. And a lot of this has to do with competition. So we're not just competing among our nursing homes, we're competing with the hospitals at this point. It used to be that hospitals would hire folks with more experience, maybe higher levels of education. They've been struggling with their workforce. They're poaching people straight from the nursing facilities or taking folks straight from school. We understand why. We also represent the hospitals. We completely understand that there is not just a local or state workforce shortage, there's a national and global workforce shortage, so we do understand it. But one of the biggest issues I would say that our nursing facilities have is that they have seen no increase in reimbursements. They have not seen an increase in reimbursements. About 60% of reimbursements come from the Medicaid office. We have not seen any increase in Medicaid rates for our nursing facilities, and Medicare has also not increased in their coverage, but really we're looking at the state level and those Medicaid dollars. You know, that being said, this has been really difficult. I think a lot of times we have a little bit of a black cloud in our meetings with our nursing facilities, but we have a lot to be proud of. Even with all of these difficulties with workforce shortages, with lack of reimbursement, we have seen really good outcomes. We've had a very low death rate, infection rate amongst our staff, amongst our residents. I think the death rate especially has been very low. We saw in 2020 just how devastating COVID outbreaks could be in our buildings. I was frankly blown away by what our Hawaii operators did during the pandemic to keep people safe. My grandmother actually lives in one of our member facilities, and they face some very, very difficult challenges and situations. I was very impressed with their communication, their quick response, and they make us even now wear PPE and gowns and really good respirators if we ever go to visit her. And I'll talk a little bit about some of those regulations later. But I do want to touch on the vaccination rates, and it's partly why we've had such good outcomes. Our vaccination rate, which is the 2 series for the mRNA vaccines, or 1 for J&J, we are in the top. We were for a long time, Hawaii was at the highest for the staff full vaccination rate. And I just want to notice here that our booster rate is actually very good. We just got the updated numbers this morning. We're at about 60% of staff that are boosted. We are #1 in the country for staff that are boosted in our nursing homes. And I think that's actually an undercount just because of the way that people are getting boosters. Sometimes they're not reporting it, but we are leading the nation in our staff boosted rate, which is something that we should be very proud of. And I know our facilities have been working very hard on in partnership with the Department of Health. And then in terms of the residents, very high vaccination rate. I think we know a lot of this, but also the #1 boosted rate. And that's also a testament, I think, to our operators in our nursing facilities that they've prioritized this. I know, for example, the nursing facility that my grandmother is in prioritized this. As soon as she was available, they got her boosted. They worked really closely with my mom to make sure that she got her booster, which is clearly providing a lot of protection, continuing protection for our nursing home residents, even during the Omicron surge. So I do want to say, so we've had a lot of difficulties. We've done pretty well. And I want to talk about how, Congressman Case, I really appreciated what you talked about with these federal requirements, where there have been a lot of additional federal requirements on our nursing homes that I don't think any other healthcare setting has had to manage. We understand why. Again, we saw how devastating outbreaks could be in nursing homes. We saw that there were a lot of really bad situations in Kirkland, for example, when everything started, and we understand that there was a lot of focus on nursing homes, rightly so. But even with no increase in reimbursement, very little in provider relief fund, struggling with workforce issues, we've had to implement vaccination requirements, reporting requirements on vaccinations and other data. And there have been very rapidly changing infection prevention and control guidance from the CDC, from CMS, from our state Department of Health, and sometimes they don't always gel. So we're trying to figure out which pieces we need to pull, which requirement we need to follow. Should someone be quarantining for 5 days or 10 days? if they had 2 shots, what does that mean? If they had a booster, what does it mean? That's the type of thing that we've been struggling with. And I'm going to have Wes and Susie speak to that more because they're living that every day. But I also want to talk about the other common issues for our nursing facility members. And really what it comes down to is workforce and reimbursement. I think you have to marry those. It's very difficult, I think, to look at these issues and not say our workforce costs are going up immensely, right? We're paying $100 an hour sometimes for temporary staff, but we don't have any increase in reimbursement. And one plug I'd like to put here too is I think many of you know on this call, we're looking at raising the minimum wage. I would say that when I've talked to members, they are very supportive of raising the minimum wage. We want to make sure that people have economic security, but if you're receiving these flat rates from the federal government, right, you don't have, it makes it a lot harder to attract and compete with a lot of the other, industries that we struggle with, like tourism, right? Like the restaurant industry. If they're paying $18 an hour and they're able to increase their prices, we don't have that same flexibility. So if there is any way to increase the federal reimbursements based on any increase in the minimum wage or on the contracts, I think that would be very helpful to think about. But I do just quickly want to talk on the federal opportunities because, we are very focused on what your office can help us with. I just want to say thank you, first of all. You have sponsored HR 5312, which you also sponsored in the last Congress, which would apply a cost of living adjustment for our nursing homes for their payment rates. That would be an exceptionally helpful bill to pass, understanding that it's very difficult to get anything passed, especially in an election year. And there's been so many other things going on, so many other priorities. But this is one thing that we've been really focused on and just really appreciate your continued support. But a lot of other things that I know we've talked to you and your staff about, which is raising the floor for Medicare, the work gypsy for physicians in Hawaii. That'll have a cascade event, hopefully increase the number of physicians in the state. If you're paying physicians more under Medicare, usually commercial and Medicaid will follow. So we think that would be good overall for the entire state reimbursement for physicians. But I do want to focus on a few other things is providing additional provider relief funds. There's a bill right now in front of Congress to provide additional provider relief funds. That would be something that would help the entire healthcare industry here. The extension of the public health emergency and also notification 60 days prior to the end of the public health emergency. I think one of the things I'm hearing from our members is they've created structures under the public health emergency to allow more care for their COVID patients or allow a safer environment. And they need time, right, to take those structures down, for example, right, or hire more staff or change their processes. So we do want to emphasize that we do need some notification, maybe 60 days prior to the end. But I think another thing that we are talking about more on the state level that we can't really do much at the state level about, which is why I wanted to bring it up on this call, is immigration of certain workers. I would say that I think in the immigration process, a lot of time more highly skilled workers are prioritized in that process. We have a big need for entry-level nurse aides in our nursing facilities and in our hospitals. And so I think we don't have all the answers to that. I think we're just talking about it now as an industry, but that is somewhere that I think we could get some help on the federal level. I do want to, though, hand this over to a couple of our members because I think they have the lived experience and I did want them to provide their insights. So I'm going to hand it over to Wes Lowe now. He's the CEO of Ohana Pacific Health and Halemakua on Maui. Have him maybe speak to some of their experiences and then have him hand it over to Susie. Thanks, Wes.
Thanks, Paige, Congressman Case, Rep Hashimoto, ladies and gentlemen. I'll make this real quick. You guys are real smart guys. I think you guys took a lot of the real key things to talk about. But real fast on COVID and what sort of transpired, and then just some thoughts as we move forward. So number one is I think that we all were aware that the silver tsunami was coming. I think, frankly, we are reaching the tipping point that it is starting to hit us right now. And we got about 10 to 15 years before us baby boomers turn 80 years old, 15 to 20 years. And I am at the height of the baby boom. And we will go from the lowest number of 80-year-olders to the highest number of 80-year-olders in probably 15 to 20 years, and no workforce behind it. So well, I think we're starting to reach a tipping point, and COVID sped it up a little bit. So there's continued need for services. I think during COVID, there was delayed care. And I think there's higher acuity now coming out of the hospitals, et cetera. And certainly during COVID, there was a fear of institutionalization. So the landscape sped up tremendously during COVID, which is not necessarily a bad thing, but we got to get there now. I think this is something we've always wanted to do, is try to use more technology, aging in place, try to do these things, but it happened so quickly, which we weren't prepared for, I believe. I think also what's occurred in COVID is there was a greater focus on social determinants of health. And I think part of that is the demographic change. The affordable housing issues are popping up like mad, as Troy mentioned in Maui. It's the #1 issue right now. And then we started seeing things around food security, isolation and loneliness, and just overall affordability and health. So these things really happened quickly to us during COVID. And I won't get too into it. I know we don't have all kinds of times here. What's happened now, some of the issues that we need to pivot fast on. Obviously, one is workforce. And so one of my favorite sayings is the problems of the healthcare delivery system manifest themselves in the emergency room. So all the effort and the resources go to the emergency room, but it's a problem with the system. So there was a lot of money given to hospitals to get their staffs up, which they needed for sure. But when you really peel the onion back, it's having a fluid healthcare delivery system. The goal is not to get people into the hospital. The goal is to keep people out of hospitals. I worked at a hospital. I even said it then, but I understand the stresses and strains. This is nothing at the hospitals. They have to do what they have to do, but we need to start focusing a little bit bigger picture on that, which goes back to the social determinants of health. So as we're seeing this, the wages increase caused wage wars, not only outside of the industry with the visitor industry, but also within the industry. People just had to get staffing and started going up. The fear I have, and Paige and I have talked about this at length, is that Medicaid is a game of pennies. And I think about probably 70-80% of our nursing home is Medicaid business, not Medicare business, Medicaid business. So in a game of pennies, when your wages go up and you don't get reimbursements, the danger is that people will start selecting not to admit Medicaid people, which will cause a backup in the emergency room. So it's not just necessarily asking for reimbursement, it's how do you deliver a better, cheaper, more affordable quality system of healthcare is really, to me, part of the keys in this. And frankly, you guys already kind of talked a little bit about it. It's things like Section 8 and affordable housing, senior independent living, but you need to have the ability to care for people at home now, not only from their healthcare needs, but from their social service needs, food security, transportation, activities. Loneliness is the bane of aging, right? To make them vibrant people, because this will be the biggest part of our population. And as you guys say, if we don't start to fix the Section 8 and independent HUD type of living, we potentially could have homeless aging populations, because the baby boomers are moving through the system. And as we all know, as you age, there is even a greater bifurcation of income as you move across that. Okay, so I'll stop here real quickly. So I believe that there's solutions, and we all know that the healthcare system can be cheaper and more efficient, but in order to get there, not only does the payment system have to change, which is slowly starting to change through the Advantage plans. And frankly, Judy Moore Peterson in Medicaid has a vision. It's a great vision, but Medicaid is not, it's really at the lower end of the spectrum. So people can't invest in changing the system to do that. So I think for Congressman Case and Rep Hashimoto, one of the biggest things I would ask of you folks is the leadership in convening us to start taking care of these cross-functional problems. And also, I think that if there's some pilot projects and investments in transitions in care, moving people out of the hospital and out of the nursing home faster into home will lower the cost of care, but we don't have enough money because of the reimbursement system to pilot it. So if you were able to have some investment in that, and we are working with the insurance plans, the Advantage plans, is to actually prove success in actually lowering the cost of care, cost avoidance, if you will, as opposed to just saying is we need more money. I get the problems you have. Is you can't just ask for more money unless you're actually going to be fixing the system somehow. So I won't talk anymore. I think that there's just tremendous opportunity. I think your guys' leadership this is awesome. And some of your guys' discussions are awesome. I mean, putting together the Section 8 with wraparound services could really help the healthcare system. And then, dealing with the care homes, trying to understand the Medicaid and the demographics and changing your workforce. Oh, I'm sorry. One last thing is your investment in workforce is key for us. We got to build pathways. There's not going to be more workers coming in. So we need to train them more and create a delivery educational pathway that gets people to their highest level. So we can bring them in as a CNA. We have a plan that I think we call it 16 to 26. Bring them as a CNA, and these guys don't have the resources to go to school, and train them in an earn and learn environment so that they can become a nurse after 10 years at like some of the highest pay in Troy knows this, in Maui, that is the highest paying profession in the Bureau of Labor and Statistics. So all these things need to work together, and I'm so glad that the political leadership is looking at these cross-sectional things, that I really believe that there can be a better delivery system that ultimately could save money and deliver better quality care. I'll shut up now.
Thank you. Thank you, Wes. And
Thank
Susie, let me see whether we can have some time at the end here, because I do need to try to move us through the other folks, and then we can come back. So apologies for that. Paige, quick couple of questions. First of all, when you focused rightly on skilled nursing facilities, what, just for my own clarification, and back to the subject at hand, which is our Kupuna, what is the utilization by our Kupuna in the skilled nursing facilities? So in other words, it's virtually all, right?
That is correct. You do have,
So
I think we are seeing, yeah, go ahead.
So when we're talking about when we're talking about skilled nursing facilities, we are talking exclusively, for all intents and purposes, about our Kupuna care.
Yeah.
Okay. I would love to work with all of you on the staffing shortage, especially on the federal side. This is, of course, as you well know, a critical challenge throughout the country in all professions, but especially acute in our healthcare industries, and especially acute here in Hawaii. So in some ways, we're getting a triple whammy right here in Hawaii as to our local workforce in healthcare generally, and Kupuna care particularly. Clearly, our federal government recognizes this, has obviously worked in this area. We do have workforce development. We do have COVID-19 specific emergency assistance, which helped at least in this area, but is drying up now. And I completely get the Medicare reimbursement issue. We have tried to work in that area for 20 years now. We have not had the right formula in place for Hawaii, and that's a continuing challenge for me in our office, because we cannot persuade Medicare that their reimbursement rate across the board for Hawaii is just completely out of whack with actual costs of delivery here in Hawaii. So, I guess I'm asking, and not right now, but what else can we be doing from a workforce? And by the way, to your point on immigration, I completely agree. I am also on immigration bills that would focus on immigration reforms that are specific to skilled workforces. So I think we're going to go in that direction. I think immigration has been a frustration for all of us in Congress, but it's pretty inevitable when you take a look at the workforce shortages out there that we're going to have to go in this direction, as other countries will have to. So I'll stop there, and just an invitation for further discussion. Okay, let's move on to Robert Hirokawa from the Primary Care Association of Hawaii, and about 10 minutes each, because I do want to leave time at the end.
I'll be brief. Thank you, Congressman Case, for putting this together. And I also wanted to thank Nick for getting me involved in this and getting me caught up to speed. So thank you. So I'll just be very brief. I'll provide a very brief overview of Hawaii's federally qualified health centers, or FQHCs, and then talk about two programs that actually speaks to what Wes was referring to in terms of programs that are preventive in nature for Kupuna. So first of all, we have 15 FQHCs operating in Hawaii right now, 7 in Honolulu County, 4 in Maui County, 3 in Hawaii County, and 1 in Kauai County, serving about 150,000 patients in 2020. That's the latest data that we have, of which 13%, or about 20,000 folks, are 65 years and older. 38% are Native Hawaiian or other Pacific Islander, and this includes our COFA citizens. 15% are best served by a language other than English. 71% live below the federal poverty level. 12% are uninsured. 55% are on Medicaid. 6% are homeless, and 2% are veterans. So that's a kind of just a brief overview of our FQHCs in Hawaii. So onto the first program that I wanted to share with you. And this program is actually, the acronym is called GRACE, and it stands for Geriatric Resources for Assessment and Care of Elders, or GRACE. And basically, it's an evidence-based program that provides in-home supports through a nurse practitioner social worker dyad to address geriatric syndromes. And the program is really focused on providing in-home services to our high-risk elderly population at home. And so examples of the GRACE focus areas include advanced care planning, medication management, weight loss, malnutrition, and mental health. And basically, the nurse practitioner social worker dyad is supported by what is referred to as an IDT, which is an interdisciplinary team made up of a geriatrician, pharmacist, mental health providers, and so forth. And so the dyad basically provides the aspects of a case to this IDT, and the IDT helps the dyad to kind of sort through things and figure out the best form of care for this individual and their family. And of course, the PCP, the primary care provider, is always kept informed of the patient's progress through this dyad. Right now, well, the current cohort is small. It's more of a pilot, if you will. But at least for now, so far, the initial data gathered does show promise that this program is effective. The GRACE collaborators include Aloha Care as the Advantage Plan, and 3 sites on Oahu are currently participating. This is Kokua Kalihi Valley, or KKV, which is a health center, Waikiki Health, which is another health center, and then University Family Medicine at Palimomi Medical Center. The other collaborators in this GRACE program is JAPSOM, the Department of Geriatrics, and the GRACE Training and Resource Center at the Indiana University School of Medicine, because actually they're the ones that actually developed the program. And so they were providing consultation to us in the first year of development and implementation. And this is where we got all of the advice and consultation from. And of course, the HPCA, which I'm part of, is also a collaborator on this program. The second program that I want to refer to or to share with you is called the Age-Friendly Health System Program. It's actually a program out of the Institute for Healthcare Improvement, or IHI. And this program here in Hawaii is actually part of a HRSA-funded Geriatric Workforce Enhancement Program, or GWEP. And Hawaii's GWEP grantee is JAPSOM Department of Geriatrics. So by using an age-friendly health system approach, providers are able to focus on the patient-centered medical home concepts to address the experiences and potential needs of our elderly population. And this is actually accomplished by addressing what is referred to as the 4 M's, which are what matters to the patient or to the patient and the family, mentation, which includes dementia, delirium, and depression, mobility, and medication. Right now, we do have some age-friendly health system recognized sites actually in Hawaii right now, recognized by the Institute of Healthcare Improvement, or IHI. So right now, as I understand it, all of the Kaiser Honolulu locations and Kaiser Wailuku are recognized sites. We also have multiple sites within the Queens Health System that is also recognized as well. We have the Palimomi Family Medicine clinics that are also recognized as an age-friendly health system site, as well as the University Health Partners Family Medicine Clinic. I think that's the JAPSOM Department of Family Medicine Clinic. They're also recognized. And we also have KKV, Kokua Kalihi Valley, right now working towards their recognition. They already sent in their data, but they're waiting for some things to be clarified, and other FQHCs to be determined. So the PCA is working with with JAPSOM Department of Geriatrics to spread this program to other health centers across the state of Hawaii. Our next target, we hope, would be Waikiki Health as well. And with that, thank you.
Thanks so much, Robert. Just a couple of clarifications, both for me and for everybody listening in. So first of all, the Primary Care Association is the representative for our community health centers, right?
That's correct.
Okay.
Yes.
And these are what you and I know of as FQHCs, federally qualified health centers, but these are the community health centers throughout our state that really supplement primary care delivery, as you say, for just an incredibly diverse and population that often does not have easy access, at least to healthcare, or at least is not comfortable utilizing, kind of other healthcare facilities. Is that right?
That's correct. Yes. The focus is on our Hawaii's, our vulnerable communities and populations is where the health centers focus on.
Right. And, personally, I have believed very, very strongly in our community health centers for a long time now. And so, seeing the network expand throughout the state, I think when I was in Congress the last time, 2002 to 2007, I think we had like 6 or 7. And now to see it go up to 15 with a much greater representation across the state is really great. And I would encourage anybody who hasn't been into a health center to go in and spend time in a health center, because you really get a sense of how important they are. Kalihi Valley Health Center, Waikiki Health Center. These are centers that I've been in the last 6 months, especially to check in on COVID-19 is just really critical. And they function with a great deal of federal support as well. So this is an area that I definitely focus in. And I just wanted to make sure I got the stat right. Back to the subject at hand, which is our Kupuna. Did you say 13% of FQHC is 65 and older? Did I get that right?
Yeah. So right now, out of the 150,000 patients served, this is it's a little dated. It's 2020 data. At that time, 13% or 20,000 folks were 65 years and older.
That seems low to me. Do you have a sense of, I guess the question is, if our overall population is higher, and if, as I think we all understand, our overall population also often has real challenges and just generally on an economic perspective, but also just access to healthcare, why aren't they utilizing the FQHCs more?
It has been historically on the lower side of things. I think the bulk of in terms of age demographic of patients served at health centers are usually on the younger side. A lot of kids, for example, a lot of younger adults, under 65. But actually, I've been looking at that data, tracking it, and the number of folks 65 and older that are being taken care of at a health center is growing. It's steadily going up. So it is growing, but it is historically has been on the lower side of things because, again, the age demographic has been more on the younger side. Like, for example, children is a pretty large focus of the health centers are children. And but again, that 13% is growing. It's slowly going up, as Wes was referring to. And we're going to see, the silver tsunami. So I'm expecting that number to go up as we go forward. Right. And again, the other thing too is this is 2020 data. So again, the data that is the reason why I have this data is because FQHCs are required by HRSA to report annually their patient demographics and characteristics, but it's always 1 year, 2 years behind. So that's it is a little bit dated, and this is at the peak. If you think about it, this is 2020 data, so this is the year of the pandemic, right? So it's going to be very interesting to see what 2021 looks like and so forth. But this is at the peak of the pandemic. Is this data that I'm sharing with all of you? Okay.
I just wonder out loud whether one thing we all ought to look at a little bit more is whether there are, some kind of obstacles I'm not aware of in terms of our Kupuna accessing health centers if they don't FQHCs, that is, if that's a widely known, widely accessible option. Anyway, it's just a question that we can answer later on. And then finally, just quickly, do you know whether the GRACE program and the Age-Friendly Health Systems program, do they have federal funding behind them in some way, shape, or form, or are they independent? What kind of government support?
I think I'm correct in saying that there is no support that I know of. So for example, the GRACE program is really being funded by Aloha Care for the most part, because they just think it's the right thing to do. I don't believe that they're getting financed in any way other than what they get for, their capitations to be an Advantage plan.
Okay.
The age-friendly health system, I don't know, maybe even Paige might be able to help me with this. I don't think that there's any funding behind it. I think all of these queens, et cetera, who is doing this, they're doing it because it's just a way to improve the care that they provide and to focus their efforts on our Kupuna. So I don't think that there's any, not that I know of, any funding in particular for this age-friendly health system program. I think it's really done because it's the right thing to do. These facilities see it's the right thing to do. So it's
Okay.
a recognition. It's not, there's two levels, level 1 and level 2. And it's, I don't want to say it's easy, but it's something that is attainable, if you will. But what it does, though, to me, is what it does for the facilities is to make sure that that they have structure and that they have intentionality on providing care that is really patient-centered, but in this case, patient-centered for our Kupuna population, right? Because it's a little
Okay.
different. Yeah, so I don't think there's any funding per se though for this.
Okay.
I wish there was. Thank you.
I'm always on the lookout for a way to match up federal programs and funding with needs back home. So that was the reason for my question. Okay, Derek, Ariyoshi from the city and county, couple of 10 minutes or so. I would personally be interested in kind of how the COVID funds have been, utilized for our Kupuna in particular, and perhaps equally important, where did it not work so that we can improve if and as we have further assistance.
Okay. Aloha, Congressman, fellow Kupuna advocates and champions, a lot of familiar faces. Robert, real quick, I wouldn't mind touching bases with you on the age-friendly health systems offline,
Sure.
see if there's some synergies there.
Yeah,
I appreciate the opportunity to speak to the power of community partnerships and the deep impact it had in responding to the needs of our Kupuna during the pandemic. How those built partnerships successfully allowed us to access and mobilize, Congressman, those funds that you speak of, and taking lessons learned to replicate some of the coalition building models and efforts now and into the future. March 2020, we know this pandemic hits our shores with respect to food insecurity. It was the perfect storm. Kupuna were a vulnerable population for respect to potential health impacts of COVID, hoarding of food and groceries at stores. And basically overnight with the stay-at-home mandates created homebound Kupuna virtually overnight. Now, phone calls from Kupuna to Elderly Affairs Division and families came fast and furious, and that's nothing new to those folks on the call, particularly seeking food and meal support. And that all too familiar knot in your stomach knowing that we didn't have the organizational capacity to support the larger community needs with food security. Now, at the same time, we had community organizations in similar positions to Elderly Affairs Division that were offering their help as well. And we were desperate to find a solution. Yeah. And in that desperation, we reached out to a core group of partners. We reached out to Keali'i and AARP and Audrey folks, Aloha United Way and Hi-Fi. And I wish I could tell you that we had some grand, innovative model to roll out, but the truth is it was out of desperation. Now, in that, we had some key partners like AARP, Hawaii Public Health Institute. That was a key organization that eventually served as that backbone agency that helped us manage, deploy, and coordinate amongst cross-sector community partners in the management of those funds. So what we did during those early months was essentially bring these partners together. Small group grew to over 60 coalition members as part of the Kupuna Food Security Coalition. And we put all our resources, organizational resources, where we had assets onto the table and figured it out. How do we mobilize and support our kupuna? Now, Congressman, mind you, those first few months, there was no federal funds at that point in the pipeline, zero funds. But what we needed to do was work with our private partners, nonprofit, academia, government, and just figure it out. And I think in that desperation was inspiration, that there was new partnerships that developed. Show Aloha Challenge was one where our restaurateurs said, we have the capacity and energy to produce the meals. We do not have the capacity to receive and intake and register our kupuna for those meals. And we do not have the capacity to mobilize and get those meals out to the community. Zero federal funds. What we're able to do is work our partners. St. Francis Healthcare Systems agreed to serve as that call-in center to take and screen kupuna inquiries. Hawaii Meals on Wheels stepped up and said, okay, we're gonna come in and we're gonna pick up the meals at the restaurants and we're gonna deploy them to the doorsteps of our kupuna. And the momentum and energy started building. KHON, we worked with them to do a week-long telethon for the Kupuna Food Security Coalition, getting private donations from the community. And each episode in the week highlighted the amazing efforts of our community organizations. So now we had private monies to deploy out to the community for meal services. We hit the mark, and I would say we're lucky in some sense that we were intentional in building data collection early on into our efforts, and using US Census data, Aloha United Way Alice report data. We knew where the pockets of poverty were in our community. And in those limited funds at that point, we could deploy those resources out to those high poverty areas. And we had those numbers to back it up. And with those numbers and the energy building, our philanthropic partners started approaching us and asked, how do we be part of this energy and this momentum? And 2 years later, $7.8 million, no federal, no state, in philanthropic and community donations were mobilized out into the community. And to your question, Congressman, now, what did we do with the federal supplemental monies, the CARES monies? By the time that those monies came to us, we had to build partnerships in place. We ironed out the wrinkles and had those networks of services and tested the waters already. So I think with those CARE monies, utilized the same partners, we expanded what we did, bringing meals into now Kupuna housing properties. Part of those monies we built in what a lot of our my other friends and colleagues are speaking about, the wraparound support services, friendly phone calls, benefits, enrollment, counseling, wellness checks. There was a lot of lessons learned, hard lessons learned from that, but I think we got a lot of new insights on the playbook of services, especially during times of emergencies and disasters for vulnerable populations. So Congressman, if you think about emergency response, right, in food and vaccinations, it's mass food distributions, mass vaccination events. And guess what? Those models work, but they work for the masses. And I think that's where we had to flip the playbook, where we needed to make sure that we had the strategy in place to bring those services, reduce barriers and access to support Kupuna. So we took the playbook that we learned from the Food Security Coalition and through amazing partners like Keali'i, Hawaii Public Health Institute, and many, many others. We rolled that into a new coalition called the Kupuna Vaccination Outreach Group. The same barriers and challenges for food access were the same barriers and challenges in vaccination access. If we can all recollect that registration for vaccines were largely and almost exclusively early on online. And we know our Kupuna. And we talk about the digital access as great as telehealth is, and it's the move that we're going to go into the future. Unless we're supporting access, digital access for our Kupuna, making sure that they train and understand it, that creates not only a digital divide, that creates a divide in access to services and programs that we saw in the rollout of the vaccination. So in that, again, we tapped into our community partners. We contracted and stood up a Kupuna vaccination registration call center, teaming up with Aloha United Way, St. Francis, where Kupuna could then telephonically call and be registered for a vaccination appointment. We mobilize with our community partners, and that's where the credit goes. It's not with Elderly Affairs Division, it goes with the community. Our vaccination partners, the Language Access Board helped us with interpreters, and we brought vaccines and boosters into Kupuna housing properties. Many of them, you folks know this, low income, limited non-English speaking populations, our most vulnerable populations. We brought vaccines into adult daycares that were largely forgotten, adult day health centers, senior centers that were largely forgotten. So that's what I leave with you, Congressman, is that there are so many challenges, but so many opportunities provided to us, new lens in how we look at things, opportunity to flip the playbook. I would add real quickly, it provided me some insight with government and how we lead within government organizations. My opinion is, too quickly do we default sometimes in government leadership from that top-down approach and from that command center approach. And there are certain situations that is appropriate and relevant, but in a dynamic nature that pandemic has caused, there's value in government leadership on the other side of the coin, where we need to sometimes stay out of the way, and in leading, bringing community voices and organizations together, because I don't think we give them enough credit that oftentimes community challenges, the solutions are at the community level, and we have to be mindful sometimes that we have to trust and empower our community to drive and find those solutions. So I'll leave you with that, Congressman. I do think and ask for your support that if there's federal funding available, that we continue to support backbone organizations like Hawaii Public Health Institute. And a lot of the good work and momentum built during the pandemic and these coalitions are now being integrated into a larger Kupuna collective group. And I think organizations like HIFI and other backbone agencies really allow us to replicate some of the good strategies that we've incorporated. Thank you.
Thank you so much, Derek, and thanks for kind of that recitation of what a lot of people did early on, especially I remember those early days like all of us, and it was pretty intense. And of course, we were scrambling in Congress to get the aid out, at least the first package, as soon as we could. We actually did get it out within about 2 months, as I recall, but it took more time for the administration to process it and actually get the money out. And so there was a good chunk at the beginning where it was just all of us trying to do it together outside of the federal funding. And I think you couldn't have said it better in terms of the partnerships that were developed and the lessons that were learned. I liked that comment that we wrote the playbook on how to provide services. I would make 1 or 2 comments back to you. Again, yeah, absolutely on the federal funding, because of course the city and county of Honolulu was the recipient of a lot of federal funding that you have channeled very, very well. And I spoke earlier about the city and county of Honolulu being recognized, and one of them was a rental and utility relief program, which was, of course, of great benefit to our Kupuna, who were under great stress in that area, where the city and county was recognized as one of the best in terms of the entire country. And that came from a partnership, as you said, between the city and county and Catholic Charities Hawaii, and the Native Council for Native Hawaiian Advancement. And so that's a good solid model that we can all use. And then the second comment I would make is that you spoke to, tele anything and to remote anything. And we all know that this was an incredible challenge at the beginning and throughout the crisis, really, because there was such an inconsistency and availability of access to remote telehealth, telemedicine, telebusiness, tele-social connection. The bipartisan infrastructure plan that we just passed in Congress last November provides really a once-in-a-generation opportunity for us to lock in a really good broadband network throughout the city and county of Honolulu and the state. And so I think that as we look to our Kupuna, let's remember that it's the infrastructure side of things as well, and target a lot of that broadband money, which is going to be coming to the state and the city. You're going to make those decisions about how to spend that, not Congress. Kupuna really stand to gain in that area. Okay, so obviously we set too little time for this, and I should have known it considering the subject and the panel and the ideas that we all want to share. So what I'm going to do is we're going to go to Keali'i in a second, but we won't have time really for a kind of a Q&A section at the end. But we'll do as much as we can with Keali'i and then wrap this. But Nick Luna is going to put up on the screen, and to all of you, his contact information. If you could please send your questions, your comments, your requests for follow-up directly to Nick. We'll use him as a clearinghouse to share further thoughts and answer questions, and we'll share around to everybody participating kind of what came in and what's going back out. So with that, Keali'i, up to you to summarize a very tough subject for all of us.
Sure. No, and I can be pretty quick. I think one of the key things, Derek kind of touched upon the issue a great deal about partnerships, and so I won't address that as much, but wanted to just say, the flexibility that was permitted with the again within the constraints of the Older Americans Act funds, I think also allowed the city to really provide an increased capacity for a lot of the partners. So as he said, the structure was put in place, but once the funds were available, the city was able to increase capacity for many of those partners to do even more of what they were already doing. So that continued flexibility is important. The other thing I would just touch upon, and Paige did a great job, as did Wes and Rep. Hashimoto, about workforce. That is one of the most significant challenges for many of the healthcare providers in Hawaii and probably across the country. But the other thing I really want to make sure we don't forget about, and was an important part of ARP's advocacy, is the home and community-based services. They aren't federally regulated. There isn't as good an infrastructure to get information out to these 1,000 plus foster family and adult residential care facilities. And they're an important alternative in the overall care ecosystem of health, long-term care assistance for people. Ideally, if they can, stay in their homes and be cared for by their loved ones, that's one thing. But the degree to which Medicaid and increased support to Medicaid for home care is critical. I know you were supportive of that. Lots more needs to be invested. And I think, going back to Rep. Hashimoto, I think a lot more needs to be done in increasing the percentage or support that's given to home care, home-based community services. Because again, in Hawaii, almost twice as many beds are provided in these smaller community-based operations than there are in the larger facilities. Larger facilities do a great job. Paige's group, people who can afford it, have that certain level of quality of care. And there are those who perhaps don't need so much acute care, but still need some kind of support because they don't have family who can take care of them in their homes, like we do in my family. We got 5 of us who take care of mom 24/7. But the important part, for example, in Medicaid, is that the cost for, again, great, not to undermine the skilled staff, but what it costs to for one staff member to care for a patient in a healthcare facility, you can have 3 residents cared for at that same cost in home community-based services. So again, you need them both. We need them all. There's a backup in that, and so from ARP's perspective, we appreciate Congressman that you have been a very big supporter of Kupuna issues, and the House did pass legislation to increase the investment in Medicaid for community home. Yes, I know the challenges in the Senate. You and I have had conversations about that. That's an important issue. I mean, I think clearly being able to address those issues. The last thing I will touch upon is another thing that Derek talked about. And if you haven't had a chance, Congressman, to talk to or engage with the Hawaii Public Health Institute, they were a critical linchpin to quick deployment of a lot of these resources because they were very nimble. And I think they're going to be critical because Derek and several other really smart folks out there are pulling together what they're calling the Kupuna Collective, bringing these coalitions together, formalizing that so it doesn't all fall apart, between now and the next situation, and being able to have that continuity that normally you might call upon government to do, but really needs to be part of this process. And I will definitely encourage Jessica from Hawaii Public Health Institute to follow up with your office to find out what kind of federal dollars are available, because this kind of infrastructure, separate and apart from service delivery folks, is going to be key for any future crisis. And let's hope it's not right around the corner. And that's my conclusion. But thank you. Everyone here has been wonderful partners. We've all worked together and appreciate, again, the support of your office and you, Congressman Case.
Thank you, Kelly. It's been a wonderful, back to you. It's been a wonderful partnership with AARP, especially in the middle of a crisis. A couple of comments back to you. A lot of the flexibility that we instituted during the middle of COVID-19 proved to show the way forward in a non-emergency area. Telehealth would be the primary example of that, where the Medicare restrictions on the use of telehealth were way too tight, in my view, to start with. And of course, in the middle of COVID, we loosened those. And our challenge and opportunity is to continue the lessons that we've learned during COVID-19 into kind of the next chapters of Medicare and definitely medicine generally, because that's where medicine is going and should go. I think that I hear you loud and clear, all of you on the workforce. The federal government obviously has a role to play there. Many of you have mentioned, Medicaid, which of course is technically a state determination, but the federal government has a clear role to play in Medicaid with our federal match. And one of the primary examples of this, going back to really our community health centers, is the work that the delegation led by Senator Hirono, who deserves the credit, in expanding eligibility for the federal match to the COFA residents. They did not have that. And there was a tremendous burden on the state, resources through Medicaid because they had to pick up that difference without that match. And so that initiative alone on the federal delegation side is probably, I think it's in the range of 100 million plus or something like that. So that's an example of how we can work through these areas. I think I'm particularly interested in kind of following up on the comment about expanding Medicaid and the federal match from a home and community-based services perspective. And that just kind of caught my attention as something to go work on, because I understand perfectly the movement towards home and community-based as opposed to institutional services. And then I think one of the things that's been loud and clear throughout as well is just the networks that were formed out of necessity during COVID-19. The connections that were formed in terms of any number of things, the distribution of federal funds, the allocation of PPP, and the opportunities to share information. And so the idea that that we all need to interlock a lot more to maximize individual resources is a very powerful conclusion from COVID-19, especially as it comes to our Kupuna. So, I mean, the Kupuna Collective is incredible. I think that's a great development. I certainly am going to think about whether there is some federal support for that kind of collective effort, so that we can actually, take it kind of beyond a voluntary assemblage of people that came together in a crisis into a more, permanent next chapter in terms of how we deliver healthcare in Hawaii. So, Nick, that's certainly one thing for us to focus on. So we're at 10:30. Susie, I don't mean to shortchange you here. Do you have one or two minutes to add anything, or are you good?
Nope, I think Wes and Paige said it all. We're good. Thank you for the opportunity.
Okay, thank you so much. So I'll try to wrap it with some conclusions, which I've already done. First of all, my first conclusion is we could easily go another 2 hours. And so I don't want this to be kind of the last time we do this. I think we were just starting to get to some of the things that I really wanted to focus on, especially in where the federal government can help our Kupuna to kind of refine those. And so I don't want the discussion to stop there. Please, forward your comments, your questions, your further observations directly to Nick, and we'll try to continue this collective, including the people that did not present but were listening in. I mean, we had an incredible assemblage of folks that were listening in as well. Any one of you could have been, the panelists on this, and so we need your input, and please do it before it starts to drift away from you in a busy day. So that's number one. Number two, please do again think about how our federal government can help you in your efforts, and think creatively about not just is there a federal program, but where could we actually put together a connection to the federal government that we could both create and then utilize. And I think that's a good way of looking at it. And don't assume the federal government is a static, unchanging entity. This federal government is like any government. It can be changed to adjust to needs and to better ideas. And so consider that your delegation generally in my office are interested in current federal laws and how they're applying current federal appropriations and how we can maximize and tailor them. But also interested in where the obstacles are and that the federal government presents to helping our Kupuna here in Hawaii, and how we can remove those obstacles. Along those lines, I'm going to whip it real fast here, but I was particularly focused with Rep. Hashimoto on as I said earlier, on affordable housing for our seniors and how we can improve the Section 8 program to more carefully target to our seniors. Certainly, as we discussed, federal obstacles to prompt certification of our care homes is a critical area. And Rep. Hashimoto also spoke to some of the coverages under Medicaid, which are actually topical issues in Congress right now. Again, Paige focusing on nursing facilities, and I wrote this down. It's right in my notes. We have the beds, but we don't have the staff. And that's actually a very common theme throughout. And there are a number of initiatives that we're working on to try to, work on that, both generally through things like the employee retention tax credit, but also more specific to healthcare itself, which is where we have the most severe shortages throughout our entire country. So this is not just us, but it's worsened here by our high cost of living. Reimbursements from Medicare across a range was something you all talked about. I get that. We talked about that. I need your help on that. Certainly to look for, again, the opportunities for federal increased or expanded matches to enable the state with comfort to come in and provide for higher Medicaid coverage is very important. Let's see, Paige gave me a list of 5 action items at the federal level, which I appreciate as a former member of the delegation. That's how to bullet it out to something that we actually have to work on. Couple of bills, overall Medicare reimbursements, extend the public health emergency, add to the provider relief fund. We actually are doing a little bit of that right now, where we're trying to, President Biden and we are are looking at a highly targeted further emergency assistance package to areas of particular need. Don't tell people that they're going to get another stimulus check. That's not happening. But areas where we have particular needs that have been unmet and where COVID has had a lasting consequence to everybody that fit into this category. So healthcare delivery would seem to be that. And then we talked about immigration. Wes's comments along the lines of again, social determinants of health resonated with me. Both in the COVID, but much broader than that. And because we know that Hawaii is again unique, and oftentimes those social determinants manifest themselves quite differently in Hawaii, ethnically, from geographic location, in different communities. The Kofa community would be a good example of that. And so we always have to be thinking about how we adjust, especially the federal areas, to our own Hawaii specific needs. And in the same breath, again, where's the federal government well-meaning, but they just don't get Hawaii, and we have to get them on the right track to pick up on some Hawaii differences. Robert, we talked a great deal about the FQHCs. I think I've said what I wanted to say there in terms of my full support for that. And then Derek, the idea that necessity was the mother of invention and forced us into more collaborative working relationships that we now have to continue and expand on and improve, and not just let them lapse because we knock on wood are coming out of this crisis, but they're the model of the future for how we work across the board: federal, state, local, nonprofit, community, healthcare providers, to maximize the individual contributions that we all have to make into a collective whole, which, as they say, is the sum is larger than its parts. I spoke to broadband in that context, and then Keali'i, totally on the flexibility of federal funding and application with a specific application to our Kupuna. And yes, we'll go look up the Hawaii Public Health Institute, and all power to the Kupuna Collective. So with that, that's kind of my wrap on the last hour and a half plus. I again welcome your part. I'm grateful for your partnership. My office is open to you individually and collectively. I welcome your further input, especially on the federal side. And we'll try to share this with folks so that they know there's really good people throughout this state that I'm working with to advance the interests of our Kupuna. So with that, mahalo and